I've been working in my research projects over the last 10 years with a group of healthcare decision makers, health system leaders, to really try to move this field forward, improving the quality and rigor of public engagement practice in Canada. Recently, in the last 3 years, the focus of this activity has really been on the evaluation side, which is the focus of this research project.
As practitioners in the field, we needed to begin to gather some data and some evidence that we could share with each other, to have a sense of where you are in the grand scheme of things and how you're progressing, or maybe where you need to improve.
Before we started to work as a group on this project to develop an evaluation framework that really captured what the values are in engagement and the core principles and best practices, practitioners like myself, we were looking at evaluating activities in a very sort of simple way.
Evaluation was identified as a priority for the collaborative because there wasn't really a framework that existed to be able to be used consistently across Canada. We were all doing our own separate work, often evaluating maybe individual sessions, but not able to evaluate the integrity of sessions or of engagement that was happening broadly.
The second piece to this is just the development of the tool itself, which emerged from moving from core principles and understanding and evaluation frameworks that certainly are out there around in the field, in the literature and in practice, but taking those frameworks and saying, okay, how do we move from a framework, from core principles of what high quality public engagement looks like, to how do we measure it?
It really was a blending together of the academic side of evaluation with the practical side of how that would look on the ground, working with people, getting their feedback, using the feedback to improve those processes and to ensure that your engagement is genuine and impactful.
This framework and the survey tools that accompany the framework, they've already actually started to have an impact for us at Capital Health.
I think there's a lot that we can still do together as practitioners and academics in engagement in healthcare, and I hope that we can do that.
We have had full involvement, full engagement of the key decision makers or key public engagement practitioners across the country who are going to be using these evaluation tools.
One of the most rewarding parts about working on this project were that we were able to embed the core values into the development of the framework, which was based on the core values.
Intuitively, we worked together in a way that really reflected the values of IAP2.
The way that Dr. Abelson has managed this project and created this project, it's been very rewarding.